In this video, I want to talk about some hernia myths. This was a fun idea I got while listening to one of Dr. Tofai's talks. And Dr. Tofai, if you don't know, is a wonderful hernia surgeon in California, and she's contributed a lot to the community. So the first myth is hernias must be repaired as soon as possible. And usually the rationale is that the hernia could rupture and cause an emergency. By the way, hernias don't really rupture. Hernias are just a hole in the abdominal wall or some kind of muscle layer, and through that hernia comes herniated contents, which may include intestine. And when hernias do become emergencies, we call it they become strangulated. And if anything ruptures, it would be intestine, and that would be if a strangulated hernia went uncared for hours and perhaps days. So the risk of a hernia becoming incarcerated or strangulated is not necessarily high. Many small and asymptomatic hernias are safe to observe. So we term this watchful waiting in the surgical literature. And it's found that in the groin, there's a low risk of serious complication, probably less than 1% per year. The caveat that comes to mind is babies and infants. When they have groin hernias, there's a significantly higher chance of incarceration or strangulation, and so those are typically repaired. Myth number 2, open surgery is much more painful than robotic surgery. This is, to me, a hernia myth. This is perpetuated by a lot of surgeons, and a lot of surgeons I really respect. But I think that there's a lot more to it than this. When you do open surgery, I think there's a much greater variation. So in inguinal hernias, open operations, I know a lot of surgeons have, and I've spoken to them, a lot of them have an experience that the patients are in a lot of pain afterwards. That's not my experience, and that's not the experience of other hernia specialists who do a lot of open surgery. There's different ways to do it, and in general, having a lighter hand and lighter touch with the dissection, I think, makes a big difference. Our patients who have open inguinal hernia repairs in general usually have pain requiring opioids perhaps for a day or two. Um, and many robotic inguinal hernias also require that. Some don't. But I would say after the first few days, in my experience, the recovery looks very similar. Myth number 3, robotic surgery is always best. Um, Depending on the type of hernia, the patient's body habitus, how obese they are, and various other factors, there are different techniques that have pros and cons. Robotic surgery has a lot of advantages. It's like laparoscopy, but much better. You can see more clearly, you can use more instruments. But sometimes laparoscopic surgery is actually more invasive than open surgery. Small hernias, thin patients, especially if a patient wants a no mesh technique, these are times when open surgery may be better. So it really depends. There's a lot of factors that go into deciding what's best for each patient. And so to say one way is always better, I generally disagree with that. Okay, I hope that helps.